Hello, everyone, and thank you for joining today's webinar. As you mentioned, we have a very full agenda for you today, and our objectives are really to cover a few of the key changes that we've recently seen through CMS and in the healthcare space. We are going to review a few of these changes and really specifically how your member engagement programs and approach can lead to better health outcomes, improving health, satisfaction, and quality scores. Specifically, we're going to cover how to craft notices to ensure members are informed of benefits, best practices for engaging LIS and D-SNP members, and how to incorporate a digital approach to improve member experience with HRAs. So next, we will just start at the top and talk about change, right? Change really is the only constant right now. I think we'll all say that. Change is constant in our lives. Over the past year, we've seen an enormous amount of change in healthcare, whether it's the CMS rebranding the Health Equity Index to Excellent Health Outcomes for All, pending ACA rate changes, even the TCPA changes requiring clear options for member opt-outs in telephony and SMS texting, and most recently, of course, the passing of the Big Beautiful Bill, where it's estimated that millions of Medicaid members may lose coverage. As we discuss some of these changes, it's important to remember that member outreach is no longer optional. It's really critical as a lifeline, whether you're re-engaging your members affected by policy changes or connecting with new enrollees. Constant and consistent communication is the foundation for equitable care. So before we dive into some of these changes, we are going to launch a poll. So I think you see on your screen here, if you would humor me and share your agreement with this statement. We are ready to comply with the Medicare Advantage mid-year supplemental benefit enrollee notifications. As we all know, supplemental benefits are key and important to most Medicare members, providing services such as discounts, even helping to pay bills, and certainly other supplemental benefits in vision, dental, and other things. So as you click on the screen, please just let us know how comfortable and ready you are to comply with these mid-year supplemental benefit notification. And if you don't know that, don't worry, we're going to cover that in a little bit. Okay. All right, a few of you straggling in here. Okay. So neither agree or disagree. Some disagree. Thank you. Thank you for this. So some of you agreeing, strong. Okay, so it's a mix across the board. Okay, two more questions for you. How ready are you, or are you ready for the excellent health outcomes for all, capturing LIS status and addressing social risk factors for Medicare Advantage members? As you know, the LIS is the Low Income Subsidy Program, often called Extra Help, the Medicare program that helps members with limited income and resources pay for Part D premiums, deductibles, and other co-insurance and costs. And of course, obviously, capturing social risk factors is key to analyzing your data for the Excellent Health Outcomes for All measure. There's a few of you chiming in here. Thank you. Thank you. Okay. All right. Good amount. All right. So we've got another distribution here. 11% disagree, not quite ready. Agree or disagree. 33% agree and strongly agree. I like that. Very good. Okay. Excellent. One last question for you before we get into our big content. How ready, or are you ready to comply with the D-SNP HRA requirements? Again, if you're not exactly sure what those are, don't worry, we're going to cover that. You all know the D-SNP populations are growing, with 12 million members are duly covered in D-SNP plans continues to rise, yet quality measures often are declining, going in a different direction. So a lot of focus has been on this dual eligible population. So how ready are you to comply with these D-SNP HRA requirements? Okay, good sampling. So let's see. Either disagree, agree. Good, 41% strongly agree. Okay, excellent. Yeah. All right. All right. Next, I'm going to turn it over to Jess, and Jess is going to talk to us about some of these big changes coming.
Thank you, Leah. The first CMS change we're going to discuss today is the mid-year supplemental benefit notification, as Leah mentioned, continuing on our theme of change. So let's jump right into it. All right, so first let's talk about the value of supplemental benefits. So we know CMS is mandating this new requirement, but let's talk about why. So supplemental benefits are a major factor in attracting and retaining your members. And a 95% satisfaction rate was reported among Medicare Advantage members with their supplemental benefits. And we're seeing that these benefits are often a differentiator compared to traditional Medicare for your MA members. And so on the left, you'll see just a table of the top 11 supplemental benefits offered. And so what we're seeing right now, the key trends I just want to take note of are that there's a selective retraction of supplemental benefits. And what I mean by that is we did see over the course of these 2 years some notable pullbacks on some non-core areas like over-the-counter meds, meals, transportation, acupuncture, etc. But the core benefits remain widely available. And members, they're really receptive to these benefits. They're really happy with these benefits. And so a lack of awareness about them and any access barriers are contributing to the underutilization, which is what we're going to talk about next. So now that we know why they're important, let's review the new requirement. All right, so CMS is requiring Medicare Advantage plans to issue a mid-year enrollee notification of unused supplemental benefits. Now, this takes effect in 2026. And just to go over these requirements, this has to be a direct mail notification. It has to be personalized to your enrollees, include a list of all the supplemental benefits that have not been accessed during the first 6 months of the year. The scope of the benefit has to be included along with the cost sharing, instructions on how to access the benefit, network application info, and also a customer service number to call if additional help is needed. So it's a lot for plans to have to comply with. Now, just keep in mind, this notice has to be sent between June 30th and July 31st of the plan year. Now, this is the requirement. The mailer is the requirement, but you can go beyond the requirement for other populations to meet members where they are and to communicate important information about their benefits. So let's go beyond the requirement to engage more members with a broader reach strategy using a multi-channel approach. So we need to move beyond compliance to true engagement. So we know why these benefits are important. We know what the requirement is, And now let's talk about going beyond that requirement. So digital outreach shouldn't stop at checking regulatory boxes. We can use it to genuinely support and engage our members. And by leveraging solutions like MMS, that's highlighted as an example for today, and others, we can provide timely, accessible, and action-oriented health information. And this is why a layered outreach approach, like a text, MMS, email, calls, this ensures broader outreach and better member responsiveness. So let's take a quick look at our multi-channel outreach methods as examples. So maybe you want to deploy a follow-up text with a link to relevant healthcare content, which helps members take immediate informed action. Other examples include maybe direct links to care programs or condition-specific education, or maybe some appointment scheduling tools if you have them. There's also maybe real-time support through transfer options, right? Where you have an outreach campaign that includes an option to transfer directly to a live agent, a nurse line, a health plan resource, and this bridges the gap between outreach and action. The last example you'll see up there is including a V-card, and this ensures that members can quickly access help when they need it most without searching for numbers or links. So that V-card is sent right to the member as a contact card. And MMS and other digital solutions, they aren't just for engagement. They support compliance and health promotion as well. So think of your ANOX, your flu vaccine and preventative care campaigns, your ER avoidance campaigns, care gap closure outreach. These targeted messages help members stay informed and healthy while improving star ratings and quality outcomes. These opportunities to connect, educate, and support members reinforce desired health behaviors throughout the year, making year-round engagement a priority. And let's talk a little bit more about year-round engagement. So effective engagement can't be seasonal. Member engagement isn't limited to open enrollment or just compliance windows. A year-round strategy ensures members are consistently connected, educated, and supported throughout their care journey. So keep members informed and empowered with ongoing communication about their benefits, rights, and available resources, because informed members are more likely to make proactive health decisions and feel in control of their care. Regular, relevant messages boost utilization of preventative care services, care management programs, and virtual care options. And this translates into better outcomes and more efficient use of healthcare services in general. Better engagement equals better outcomes, especially for the Medicare Advantage enrollees. Sustained engagement correlates with improved medication adherence, reduced hospitalizations, and increased use of preventative services, all of which contribute to improved clinical outcomes and cost savings for the plan. The bottom line, when members feel supported all year, they're more likely to be satisfied with their plan, renew their enrollment, and recommend the plan to others. Therefore, ongoing engagement becomes a key driver of retention and growth, which is critical now more than ever with all the constant change that we're seeing in the environment. Now, we've talked about the benefits of a multi-channel approach, and we know why year-round engagement matters. Now, let's talk about engaging with LIS and D-SNP populations, along with a few more upcoming regulatory changes as well. So what's changing? Well, we started out with the reward factor. That was completely revamped into the Health Equity Index, and now that's been rebranded or renamed into Excellent Health Outcomes for All, which Leah had mentioned earlier in the presentation. And so the legacy reward factor, that lifted overall star ratings pretty broadly, and it made it easier to hit thresholds for bonus payments. EHO for All replaces that with targeted equity-first incentive, rewarding plans for improving outcomes among your LIS, your duals, and your disabled member populations. This shift encourages equitable care delivery and rewards plans for serving high-need populations. And this aligns financial incentives with CMS's commitment to reducing care disparities. And I just want to make a note that there were no new changes, removals, or additions to the rules used to calculate the reward in the Star Year 2027 program. They just renamed Health Equity Index to Excellent Health Outcomes for All. And so the primary focus on these groups, your LIS, your duals, and your disabled population, is because these populations are at risk for poor health outcomes. And star ratings data shows gaps in the quality of care for these specific enrollees. And I also want to note that CMS estimates that this shift will reduce excess bonus payments by up to $5 billion over the next decade. So plans have financial incentive and operational imperative to identify and improve care for members with social risk factors. Now that we know which populations to focus on for EHO for All, which again is our duals, our LIS, and disabled members, let's talk about how to effectively engage with these populations to improve health outcomes and boost quality scores. All right, so the theme for this today is capturing information, addressing barriers, and meeting members' needs. So recognizing the unique needs of these populations is critical because these members face complex socioeconomic and health-related barriers. These populations often experience higher rates of chronic conditions, lower health literacy, and limited access to care, requiring customized engagement strategies. Capture and act on social determinants of health data, because collecting the SDOH data, like housing, food security, transportation, and education, this helps uncover root causes of health disparities. And using this data, you can develop targeted interventions to close care gaps and reduce health inequities. Having diverse communication methods is also key. Phone calls, texts, MMS, emails, live agents, in-person visits. All of these ensure that you reach members where they are. And this is why a multi-channel approach increases engagement and ensures message accessibility for varying preferences and abilities. Building relationships with trusted community organizations like faith-based organizations and local care teams, this can also increase your credibility as a plan, and it also improves member responsiveness. So leverage your trusted community partners as well. Another thing to keep in mind is to develop culturally competent materials, because this ensures that all communication materials are language appropriate, culturally sensitive, and relevant to lived experiences of the populations you serve. And this supports a better understanding, stronger connections, and ultimately improved health outcomes, which is what we want. Deliver focused, simplified education around benefits, preventative care, and condition management, because increased health literacy empowers members to make informed decisions, leading to better engagement and adherence. The result of all of these, higher engagement, greater trust, better health outcomes, and increased member satisfaction. Next, we'll review a case study that shows how a multi-channel approach helped LIS members access needed drug benefits. And you can find to the right of your screen a link to this case study for more information, just for your reference. But for the purposes of today, I'm going to give you a high-level overview of the results of the study. So our engagement framework works like this: connect, educate, and support. And so for one large national plan, they had success in helping their Medicare Advantage members access needed drug benefits. They had 1.8 million member annual membership. 31% of those members were engaged through phone calls. 27% of members were connected to live agents, and 55% actually completed their applications. So we connected them through a multi-channel outreach approach. We educated them using simple, clear communication, and we supported them with guiding them through the application process. According to a PMC cohort study from 2007 to 2018, approximately 20% of non-automatically deemed LIS recipients, so those required to self-reapply, experience subsidy loss at least part of the year due to failure to recertify. And loss of LIS correlates with significant increases in out-of-pocket drug costs and a decrease in med adherence, notably for chronic conditions. So without effective support, eligible LIS members risk losing vital drug coverage assistance, impacting both their health outcomes and the plan's performance. All right, now let's pivot and take a look at the new HRA requirements. So special needs plans, they need to now conduct at least 3 live, non-automated call attempts on different days and times. And they have to send a follow-up letter if there's no response. These HRAs need to be conducted within 90 days before or after the effective date of the enrollment. And the individualized care plan also needs to be completed within 90 days after conducting that initial HRA. D-SNPs have to also have an integrated HRA for their Medicare and Medicaid plan, and this is effective in 2027. And they also need to have integrated member ID cards as well. And going beyond compliance, so for another population, if you don't have a SNP plan or a D-SNP plan, you can use a digital approach to have members schedule a time window for their HRA call and send a text reminder of the scheduled appointment. This will maximize your engagement opportunities. And later in the presentation, Leah will discuss results from a case study around the efficacy of a digital approach to HRAs and how that can improve HRA completion as well as enhance member satisfaction. And with that, I'll turn it over to Leah.
Thanks, Jess. Yes, it's important to think, certainly with all the requirements, we have to have certain things in place, but we want you to think beyond the requirements, beyond the compliance, and really think of that holistic member approach. And in doing so, you include and increase the member experience. And so we all know how important member experience is when talking about member engagement. And next, we're going to cover just ways you can leverage a digital approach to improve that member experience with a focus on HRAs. So we all know, again, it's what you say, but also how you say it that really matters when it comes to member engagement and the member experience. We all know healthier members are engaged members are healthier members, and members who with better care experiences often have better health outcomes. For example, studies of patients hospitalized after heart attacks showed that the patients with more positive reports about their experiences with care had better health outcomes a year after discharge. Preventive care also helps lower costs, and it also improves that member-provider connection. So greater satisfaction will help with cost cap scores, 30% of your Medicare Advantage star rating measures, higher health literacy, lower utilization, out-of-pocket expenses, and all of the things that help members stay engaged with your health plan. So here is an example, an illustrative example of the importance of coordination for member engagement activities on the member experience. So we have our Franny M Care, and Franny has a variety of different things that she will need to be outreach to throughout the year. She's new to the plan. She'll need a welcome call. She'll need our HRA. And if she has a chronic condition like diabetes, she'll need condition management. And also because of her age and gender, she'll need preventive screenings associated with just regular preventive care. If she's in your Medicare Advantage plan, she'll need an annual notification of change reminder. And now, of course, the benefit reminders mid-year for supplemental benefits. So these are a lot of touch points that Franny may need to have from you as a health plan. So really, she could be in 13 different measure denominators for HEDIS scores and based on her plan type and community type. And all of this needs to be coordinated and taken into consideration as Franny in a holistic way, as Franny as a member and the experience Franny has with engaging with her health plan. So let's dive into a little bit about the improving a member experience with HRAs. Challenging is that conducting comprehensive HRAs certainly requires significant resources, time, expertise, and a poor user experience can deter members from completing that HRA, really hindering your ability to find out valuable information, collect some social determinants of health, and really assess where that member is in their health journey. So some of the solutions we suggest are moving to more of a digital HRA approach. This digital approach will increase convenience and response rates, allows quick data collection, reduces administrative burden, and is much more of a member-friendly approach. Health plans are using digital approaches today, but continuing multi-channel approaches, certainly a digital approach or leading with a digital approach is very effective and can be a better member experience. Here, I'm just going to show you an example of what a digital experience might look for Franny. So let's say Franny gets a text message with a link. She comes into an application in a portal where she needs to verify who she is and then confirm some of the information as she clicks through different screens to allow her to complete her HRA. She can stop and maybe pick it up at another point in time. And if she doesn't finish the HRA, the health plan can send a reminder text message to have her go back in and complete that HRA. So it's a very simple way to do two-way data collection, again, much more member-friendly, and provides great information for you in improving that member's experience. So as just mentioned, I do want to mention how successful these digital outreaches can be. Certainly digital first multimodal outreaches with mobile call branding to increase your brand presence and kind of caller receptivity, using the MMS channel through a text showing a visual or showing a V card to indicate who to call back, either a telehealth vendor or call back your health plan. Really, digital data collection is secure and provides really key information for you as a health plan. And just an example, a large national health plan did use a digital approach to reach out to over 48,000 Medicare members. And it was a very lengthy HRA, but they used an omni-channel survey response that include IVR, live agent, digital, direct mail, and texting. 15% were engaged by clicking through that secure digital link received from text message. And the result of that, the plan saw 63% of HRA completion through the secure digital channel. So really, in summary, you can see digital approaches are effective, increase member experience, and really can be leveraged for things like HRAs. Certainly, there's a whole host of other things you can apply digital experiences for in your member population, whether it's condition management, education, and other things, but this is just one example. And so last, just as we summarize today's conversation, I'm going to turn it back to Jess to review some next steps in creating an action plan.
Thank you, Leah. All right. So not that we want to send you back to work with homework, but here's your action plan for embracing change with member engagement based on the topics that we discussed today. So Monday morning, what should you do? Well, you should evaluate your existing resources and processes for conducting HRAs and identify gaps and additional needs to meet those CMS requirements for the mid-year enrollee notification on supplemental benefits. That's paramount. You're going to also want to assess your current outreach strategies for your LIS and D-SNP populations as well. Within the next 90 days, you'll want to address barriers and connect your LIS and D-SNP members to resources to help close gaps in care. Establish an operational plan for your mid-year supplemental benefits reporting requirements and enrollee notices, and also establish an operational plan for integrating and conducting timely HRAs and ICPs. And within the next year, you should be evaluating efforts from outreaches and fine-tuning to continue to improve on your member experience. Budget for a digital-first approach that works, and continue to communicate with your members year-round. And with that, I will turn it over to Cassie. Thank you so much.
Thank you, Jess and Leah. That concludes our webinar. If you submitted any questions during the presentation, your Cotiviti account team will follow up as appropriate. You can also send an email at any time to answers@cotiviti.com with any additional questions or for more information. We'll be reaching out to you shortly via email with a link to the on-demand recording of the webinar. And don't forget to take a moment to answer our survey about your experience today. I'm Cassie Yazzo. Thank you for joining us, and we look forward to seeing you again soon.